Now, let's also welcome Mr. A Velumani from Thyrocare as well. He joins in on the show. Mr. Velumani, morning. Help us understand what headway have we made since we last spoke with you. Is the facility up and running? Are you already testing for COVID-19? Is there an uptick on the mass scale of testing which is being done?
If I have to tell it in the COVID language, we are growing 3x every day. In other words, first day we processed only 3 specimen, next day 10 specimen, today 30 specimen. So we have a reason to believe by the weekend we should be doing 100 a day, and by probably 15th of April, some 500 a day.
But what are the findings? Because, it seems that states like Maharashtra are where the maximum number of cases are being found. Would you say that we are slightly far away from stage 3 community transfer?
We don't know about the number of positive cases till we truly assess positivity. There are likely that plenty have got infected and probably do not have any symptoms. And there is a likelihood the numbers reported as infected is far low. But if I go by the numbers dead, that is quite motivating, because for such a big country, this number is telling that things are under control. But having said that, how many have got infected and got immunity also to be understood. Only when the entire population gets immunity to handle it, we are successful. Until that time, we will have enough number of people falling ill and having a serious nature of an infection.
Mr. Velumani, a very simple question. Touch wood, we are lucky, we are blessed that the numbers in India are not very large. How do you think things would progress now? Because we are in stage 2, there is an incubation stage and there is a spread stage. So can one reasonably confident that the spread is getting contained, and at the peak also the numbers will not be all that alarming? Because when I look at US, the fact that they've become bigger than China suddenly in a matter of 3 days looks like there is a problem there. But the fact that our numbers are well below 1,000, when the spread happens, how will it spread?
Oh, I am afraid already the spread is happening because of this lockdown. The people from city have migrated back to their hometown. Plenty of them are walking back, even if you have stopped everything. There is a likelihood the infection getting into bigger size we have avoided. But having said that, once 3 weeks are over, and if we put things back to normalcy, if not suddenly, slowly, the infection, the incidences of people hitting hospitals will be growing. But I believe we should have enough of infrastructural improvements in this period of time of 21 days. I am of that opinion. If we have adequate ventilators, adequate quarantine facilities, we would be minimizing the calamity even to 1/10 of what world has experienced it.
One simple follow-up question. It's not a business-dominated question, but why are COVID tests so expensive?
They are expensive. Let me very honestly tell you, the panic and the fear even does not allow the well-educated medical community to handle it. Today, 90% of the dispensaries, hospitals are closed because they are very worried that their personnel will get infected, number one. That leads to least resources available. Number two, it is the pre-analytical, that is, it's not a blood test, it is a swab test. The swab collection is very costly because you need a lot of, PPE, that is the preventive equipments. So that is literally speaking 1,000 rupees per collection. And then the people today in the lockdown cannot travel by any normal conventional routes. You have to provide a vehicle for collecting from home. Next one is the cost of the reagent today is roughly around 33% of the total permitted amount for collecting. So I am of that opinion, though I don't wish, if the pandemic continues, there will be volumes, there will be more vendors, there will be more competition for supplying reagent at affordable cost, and there will be more service providers. I have a feeling we might need a 500 testing facilities by the time when the lockdown is released, and adequate number of supplies of the raw material and adequate supplies of the consumables, if they are in place. And with Prime Minister announcing 50 lakh coverage, there will be staff who will be little more motivated to do the work related to COVID. So it's a huge stress for laboratories too, and nothing is in place. Logistics not in place, people are not in place. Every now and then you have to do some virtual conferences to make them to understand, to get updates. Let me tell you, this is the best time for a CEO to prove that he is the most powerful man to lead his organizations.
Okay, very simple question. If somebody calls a Thyrocare lab, what should one expect?
We would first, no one from outside Mumbai can call us because we don't have a facility anywhere else other than Mumbai. Then we ask him to contact a nearest doctor and produce a need for a COVID testing. That sometimes they manage to get it even without any difficulty. And then we arrange for a swab collection technician to go to their home, or we have in this city around 20 hospitals who have agreed to operate as our collection centers. We tell them to go and give the sample there. So there is a likelihood he will get reports if he gives specimen today by tomorrow afternoon. Because the sample reaching to the laboratory is taking time, and without a batch of 30-40, if we run, the costs are not in place. Let me tell you, lack of volumes is the reason why laboratory tests are always costly.
All right. Thanks so much for joining us this morning and sharing that with us. We leave it there for now. Thanks for joining us.